Good morning, amigos. Dr. Doug here at BodyTrust.com, coming to you from Los Angeles, California. Found an interesting report from the University of Vermont. And I'm just going to read you the little byline here and then talk about it. When it comes to inpatient treatment of a range of mental health and mood disorders, from anxiety and depression to schizophrenia, suicidality, and acute psychotic episodes, that's a lot. A new study suggests that physical exercise is so effective at alleviating patient symptoms that it could reduce patients' time admitted to acute facilities and reliance on psychotropic medications. Uh-oh. If they really do this everywhere, guess who loses money? The pharmaceutical corporations who produce psychotropic medications and want their medical doctors to prescribe these drugs for people instead of prescribing a trainer. There should be trainers, physical fitness trainers at every inpatient psychiatric ward and facility, getting people to move. Move as much and as often as you can, because this is all liver qi stagnation. All of these psychological disorders are really the basis of it is liver qi stagnation. Qi stagnation. The qi is not flowing. It doesn't flow. And so the jinya, the fluids, built up around the Chinese heart. This is how we explain it. Under a layer of phlegm. Now, we all have phlegm every now and then, but this is thick phlegm. And the thick phlegm really confuses, distorts the information coming into the shin, that substance that determines behavior, that lives in the heart. It distorts that information, and so the shin is confused. And the thicker the phlegm, the more confused the shin is, and so that the behavior is extremely inappropriate. It's the shin's job to pick out all the information coming from inside the body and outside the body, put it all together, and choose appropriate behavior. But when it's getting inaccurate information, which is what phlegm does, well, then the behavior is not going to be productive and not going to be healthy. Okay, so. But when we move the qi with, let's say, exercise, then guess what happens to that phlegm? It starts to go down. The body starts moving it away from the heart, and information starts becoming more accurate for the shin. And phlegm clears up, right? And the confusion starts to clear up. So, and on a regular basis, of course. Now, we also want to combine that to make sure that people are not overeating, because excess damp will also add to that phlegm. So that's all excess yin. We don't want excess yin or excess yang interfering here. So anyway, that's how I see intervention and treatment of psychiatric disorders. It must include regular exercise and trainers to help people. Now, that's my take on it. Thanks for watching. That's all for today, amigos. Hasta mañana.